Hello. There you go. So I'll share my slides that I've put together for tonight. Hello, everyone. So as mentioned, I'm CIARAN Monaghan. I recently graduated from UCD with a doctorate in environmental science. So I'll tell you a bit about what I've been researching for the last few years. So can everybody see this?
Yeah.
Okay, great. Okay, so I'll get into it. So I'm going to be talking about antibiotic pollution of surface waters, so primarily coastal waters, rivers and lakes in Ireland, and I suppose throughout the world, but my research specifically focused on the Irish situation. So specifically, why is this a relevant subject matter? Now, in my experience, it's best to tell people this sort of thing at the start, because then they listen for the rest of it, as opposed to telling them why it's important at the end, which makes people say, has this been recorded? So antibiotic resistance is a trend in antibiotic, especially pathogenic bacteria worldwide, which suggests a reduced response to antibiotic intervention. So it increases mortality versus non-resistant illnesses. So the same bacteria with a resistant and non-resistant strain. The resistant strain is, I think, 3 times more likely to cause death or significant lifetime impairment. It complicates medical procedures. So anything to do with, say, for example, surgery is made more complicated because while there is always the threat of contamination, when the threat of contamination that doesn't respond to antibiotics is present, it obviously significantly increases the risk of negative surgical outcomes. And as well as that, it places pressure on health services. So I'm sure you're all aware, there's a lack of beds and so on in Ireland at the moment. So when an antibiotic resistant illness causes someone to take up a hospital bed for a longer amount of time, obviously there's a lack of availability for getting them out, getting the next person in, and being able to provide the kind of healthcare services we want. And it also creates a burden in terms of increased use of, surgical equipment, antibiotics themselves, and so on. And for the more mathematically minded among you, it obviously costs money as well. So in terms of sick days and so on, lost productivity in the workplace, medical expenses, so expenses to the state to provide healthcare, it costs a very significant amount of money. So one estimate for 2017 estimated that 1.5 billion euro was expended specifically to counteract the negative health impacts of antibiotic resistance. As well as that, the human cost is staggering. So by 2050, it's been predicted to be the leading cause of death worldwide, surpassing things like obviously cancer, heart disease, and things like that. So a big thing that we have to kind of keep an eye on and try to circumvent as much as possible. To what extent that's trying to put it back in the box versus stop it from going any further is really down to which paper you read. So yes, in terms of the Irish scenario specifically, about 200 annual deaths. It's about 8 years ago. It's probably increased since then, unfortunately, but that's the sort of number the raw numbers we're looking at in terms of mortality in Ireland at the moment, obviously set to get worse. So what are antibiotics? Specifically, they're a large group of chemicals. Now they can be subdivided into 2 groups. So you've got bacteriostatics, which are those that halt the growth of bacteria, versus bactericidals, which are those that kill off the bacteria. They're used obviously throughout healthcare. They're obviously used in agriculture as well. There's many different classes. Now, penicillins is the one most people have heard of. You also have tetracyclines, macrolides. There's many groups, and there are both naturally occurring and synthetic classes of antibiotics. So obviously I assume we're all familiar with the original discovery of antibiotics, which was growing in a petri dish and causing an inhibition in growth in the surrounding bacterial colonies. So that was where it was first discovered. And from there, we've managed to produce it on a mass scale for the treatment of all sorts of bacterial illnesses. Now, obviously, different antibiotics and different antibiotic groups are used to treat different illnesses. So depending on the makeup of the bacteria, depending on where we want it to go in the body and so on, there's a very wide range of antibiotics. One significant problem that is caused by antibiotic resistance is that we haven't discovered any new classes of antibiotics in a long time. So obviously, upon their initial discovery, there was a boom in the number of the number of antibiotics we were discovering every year, but then slowly we've been discovering less and less. So we're coming into maybe the totality of what exists in terms of antibiotics. So once those stop working, we have a problem we can't discover anymore. Just to make it clear, they're used in very large quantities throughout the world. In Ireland, for the last 10 years, I have a figure, I think you get about 20.5 tons of penicillins used every year on average for the last 10 years. So that's one group. There's 6 other groups. Some of them are used more. So we're talking a very, very large mass of drugs that are being administered to both humans and animals every year. And that's just in Ireland. So when you scale it up, you're looking at an extremely vast amount of chemicals. So in terms of usage trends, so we're using more or less every year. In terms of human health, there has been a very significant increase in the last 20 years. Between 2000 and 2015, it was about 65% increase. However, in developed economies, so Europe, USA, and so on, that's been relatively static. There's been very little increase or decrease in the last number of years, but a significant, due to, I suppose, more availability and a sort of more an increasingly developed economy, we're looking at massively increased use in places like India and China in the last 20 or so years. And that's the case for both human use and agricultural use of antibiotics. As you can see here, 67% increase for agricultural antibiotics predicted between 2010 and 2030. And I don't think we've managed to curb that. So that prediction seems to be coming true, unfortunately. Now, it is very easy, obviously, for us to say over here that everybody should stop using them. But I suppose the reality is that we over here in the West have had our fun with antibiotics for a very long time. So it comes across as a bit rich to try and curb their increased use worldwide. So it's something we have to be sort of morally aware of as well. So in terms of their pollution of water bodies, there are 4 main sources of antibiotics polluting surface waters. Those are the aforementioned healthcare use, agricultural use, manufacturing. So a significant quantity can be released at sites of manufacture, and as well as that, disposal. So getting rid of unused antibiotics, if they're put into a landfill, obviously, and then you get rainfall onto that landfill, they can wash down into the water table, and they'll end up either in the soil or in the groundwater. And once they enter nature, they have a number of impacts that are detrimental to both human health as well as ecology. So one significant, I suppose, one significant factor of antibiotics that leads to their environmental release is their bioavailability. The bioavailability of a drug or of anything really describes the percentage of it that is absorbed by the body. So antibiotics in particular have a relatively low bioavailability. So just for example, if I give you 100 grams of penicillin, your body might absorb, say, 20% of that, 30, whatever, and the rest passes through your body and ends up in wastewater treatment and so on. So the remainder is excreted either as metabolites, which are, I suppose, slightly changed versions of the original drug compound, or unchanged. So a lot of what you eat as antibiotics ends up entering the sewage system. The same is true of agricultural antibiotics. So the same is true with animal digestive systems. Now, depending massively on the antibiotic specifically, so different antibiotics will have different levels. Some are more well absorbed than others. But as well as that, the health of the individual, I'm sure you're all familiar, you have to take certain antibiotics with food. That is because it impacts the bioavailability. So it can increase or decrease how much your body absorbs based on whether you've eaten, whether you've drank enough water recently, whether you're healthy or sick, your age. All of these things massively impact the amount of antibiotic your body will absorb. So there's looking at the sort of values I was looking at earlier in terms of numbers, tens of tons per year for certain groups, you're talking about 60% of that entering the water table. It's very obvious why a problem is developing. So entering wastewater, or obviously being spread on agricultural fields, are the 2 main ones I investigated in my research. So agricultural antibiotics, those administered to livestock or specifically food producing animals, again, a vast amount of them. an estimate, one particular paper estimates, just as a ballpark for you, 58% of the antibiotics that are administered to livestock enter soils, and from there they can enter surface waters. So you get a runoff. So if say, for example, cattle excrete a certain amount of antibiotics that they're administered onto a field, then when you get rainfall onto that field, it can wash the antibiotics down into rivers, lakes, so on. Yes, this also, just as an important note, and not to do with my research, but can cause a resistance selection in soils. So if you have antibiotics entering the soil, you can get soil bacteria that develop a resistance over time. One significant method of reducing the amount of antibiotic pollution via agriculture is manure storage. So a lot of certain antibiotics, again, as with the case with all of these things, it's more effective on some than others. Storage of antibiotics within the manure. So for a number of reasons to do with water quality, manure is often stored before it's spread for a number of weeks. I think it's between 16 and 22, depending on the animal in Ireland, last time I read it. So certain antibiotics will break down quite rapidly once stored within the manure. So certain ones will obviously are more resistant to breakdown, but you get a significant arrest of the amount of antibiotics being released. So resistance itself. Bacteria in contact with antibiotics over time will become resistant. Perhaps some of you have heard of this before, perhaps not. So just as an example, a species or a certain bacteria or strain of bacteria living in a certain river, if they're constantly being exposed to wastewater that contains antibiotics, over time, that bacterial lineage will develop a resistance. So it will be able to survive higher and higher concentrations just because it creates a selective pressure. It's just evolution, I suppose, is that if you have a constant stream of antibiotics, bacteria will also learn to deal with it. And there's a number of ways in which they do this, to do with removing the antibiotics from the cell physically, to do with breaking it down using their own enzymes. There's a number of different ways bacteria can become resistant to antibiotics. One thing I'll mention is that antibiotic resistance exists within nature. So this isn't something that we've specifically caused, but it is something that we have created a selective pressure for. So if you have 50 bacteria and one of them resists an antibiotic, you expose them to that antibiotic, that bacteria reproduces. Now you've created a selective pressure. So we're killing off the ones that are sensitive to antibiotics, but leaving the ones that are resistant. So over time, you'll get this, most of the population will become resistant. Within the sort of research, there are two different levels we talk about in terms of resistance selection. So one of them is the MIC, the minimum inhibitory concentration, which is the lowest concentration at which bacterial growth is slowed. However, a concentration below that is known to exist, which is the minimum selective concentration. So that is a concentration below any observable effect on the health of bacteria that will cause over time a selective pressure to favor those that are resistant. As well as that, we have genetic transfer. So bacteria have mobile genetic elements called plasmids. And so two bacteria, one of which is resistant and one of which is sensitive, those can actually, both living cells share genes to each other and thereby both become resistant. So they can sort of hand them a little parcel of genetics that is the code for bacteria resistance, which is, I suppose, amazing, but it's not good for us. As well as there's co-selection of resistance. So similar genetic elements will, the same, I suppose, piece of genetic code can make you resistant for multiple antibiotics. So if we have one antibiotic being exposed, then we get a lot of them. Even it can be resistant to antibiotics it's never even been exposed to before, because the same genetic traits are valuable for resisting a number of different antibiotic classes. So in the wastewater, we've taken our antibiotics, we haven't absorbed all of it, we've gotten rid of it. Where does it go? It goes into wastewater treatment plants. And now the bad news with this specifically is that wastewater treatment plants have been historically noted to be quite bad at removing antibiotics. So you can put in a water sample with a certain amount of antibiotic concentration within, and very little of that can be removed. Typically, it depends on the different wastewater treatment methods, but you can get very low levels of as little as 20, 30, 40% being removed, which means the remainder is going directly into, again, natural water bodies, rivers, streams, the coast, and so on. Full removal of antibiotics has only been seen in one study. So obviously with the hundreds of studies that there are examining this, we want to either develop new wastewater treatment methodologies that will more, that will show a greater reduction in antibiotic levels, or think of something new entirely. So there is also evidence within the literature that wastewater treatment plants can actually increase the concentration of antibiotics, which is obviously disastrous. This can be due to a number of things. Certain metabolites, which are very similar compounds released by the body, can actually be transformed back into the original antibiotics through the processes of the wastewater treatment plants. So we can see where that would be an issue. And as well as that, they might serve as a breeding ground for resistance. This is heavily suggested by the literature. So a wastewater treatment plant is a building in which you have extremely high amounts of antibiotics, and as well as that, extremely high amounts of bacteria. And again, sharing genetic elements means that wastewater treatment plants may actually be doing more harm than good in certain circumstances in terms of selecting very, very aggressively for resistant bacteria. So it's quite worrying. And as well as that, finally, we have wastewater treatment sludge. Now, I'm not sure how familiar you all are with wastewater treatment procedures, but a very common one is conventional activated sludge, which is basically a bacteria flock, which I suppose absorbs particles from the wastewater. Now, what we do in Ireland with our wastewater treatment plant sludge, once we've removed it from the system, is we often use it as a fertilizer. This can obviously be disastrous for antibiotics specifically, in that we've managed to capture the antibiotics and now we're putting them on a field and spreading them as a fertilizer, which again leads into the rainfall and runoff problem, whereby it pollutes water bodies. So we can all see why that's a problem. In terms of manufacturing, so having shown you, I suppose, how these antibiotics are escaping to water bodies from healthcare and agriculture, manufacturing is the other main one. Now, the highest concentrations of antibiotics ever recorded in water bodies come from manufacturing due to two things. So incomplete product retention. So if you have a big bioreactor vat that's making, for example, penicillin, and then your process doesn't necessarily capture all of that. Some of it is going to be released into whatever water body is receiving your manufacturing effluent. So incomplete product retention or incomplete capture of product means that if you're making a certain amount of tons of antibiotic in a wastewater treatment plant, in a bioreactor every year, a certain amount of that is not going to be retained by the manufacturing chain. It's going to be released, which obviously creates problems. And as well as that, cleaning of reactors, so washing down any of the bioreactors after use can lead to that effluent, again creating a contamination pathway. So levels with these specifically, they spike and fall. So if they wash the vats once a week, you'll get a huge spike one day a week, and then it'll fall off again for the rest of the week. And again, this one in particular, because Europe and America have sort of outsourced their manufacture, it means that very little of this is observed over here, but we've made other countries make our antibiotics for us, which means that they're the ones suffering to produce our antibiotics, polluting their own waterways, and then sending over the last product to us. So we can but shouldn't have it sort of easy when it comes to this. So it's something we should be aware of in terms of legislature and so on. So when antibiotics are present in the water, they present a number of problems, not least the resistance selection that I described previously. But as well as that, there is a potential for allergic reactions. So I think it's something like 10% of the population is allergic to penicillin. So if there are sufficiently high concentrations of penicillin in the water, that could obviously potentially be a problem. Digestive issues. So if you're ingesting antibiotic residues when going for a swim, that can impact your gut bacteria. So it might kill off maybe good gut bacteria, or it might create again, like is taking place in the water bodies, a selective pressure towards resistance within your own gut biome. Obviously, we don't want that. And as well as that, in sufficiently high amounts, it can have an impact on algae, cyanobacteria, and other trophic layers. So it can disturb the food chain to some extent. Sufficiently high concentrations of antibiotics can actually interrupt the process of photosynthesis, which means obviously you'll have plants and so on not able to work to the best of their ability, which is obviously going to create a run-on impact to the herbivores and carnivores that live there. So we can have both a human health impact and as well as that an ecological impact of antibiotic pollution. So in terms of Ireland, what's been observed in Ireland in terms of antibiotics in the waters, this is a double-edged sword, but not a huge amount. Now, that's not good news. So we haven't observed a vast amount of antibiotics compared to other EU countries in Ireland, but that's because we don't test for them very often. So there have been very few papers that have actually examined Irish water bodies for antibiotics themselves. They've been detected downstream of wastewater treatment plants. Like I mentioned earlier, we do get a lot of release from wastewater treatment plants because of that incomplete removal. 15 different antibiotics at the time of writing, when I wrote my first research paper, which is 2 years ago at this point, have been detected thus far in Irish water. So 15 different antibiotics. So I think several of those were macrolides. There were, I believe, some penicillins and so on in there. 5 of those, importantly, have been detected in concentrations, so relatively high concentrations that have been predicted by other papers and other research to select for resistance. So 5 antibiotics exist in Irish water at concentrations that are likely to create this resistance selection. That's alarming. In terms of the bacteria themselves, the good news for Ireland in this case is that we have actually done a good bit more sampling for bacteria and resistant bacteria specifically in Irish water bodies. So they've been detected in a vast different number of water bodies in Ireland. I actually had some colleagues in NUIG who put together an amazing study on this, which is available online to read. So resistant bacteria have been detected in rivers, lakes, coastal sites, and pristine areas. Pristine areas here in referring to upland areas, so that would not be getting a runoff of antibiotics from, say, agriculture or healthcare. So they've propagated upwards, which is alarming. So sites that are almost completely devoid of antibiotic use still have antibiotic-resistant bacteria, and that shows, I suppose, to some extent, the amount that this has proliferated throughout sort of natural systems. And increased resistance is always observed downstream of wastewater treatment plants. So that suggests that selective pressure is taking place there. We have high resistance levels for antibiotics. Multi-resistance, i.e. a bacterial strain that is resistant to multiple different classes of antibiotics, is common. So we see that. And as well as that, we see widespread resistance to penicillins. So the likelihood is that in any given body of water, so again, rivers, streams, lakes, you're going to find bacteria that are resistant to penicillin. Now, as I said earlier, that can exist naturally, but the data suggests very strongly that we are creating an artificial selective pressure that causes this. So penicillins are resisted by a large amount of bacteria in the Irish water bodies. As well as that, we have a risk of illness from swimming. So I'm sure you've seen cases over the years, especially in the case of wastewater being released at a bathing site. You can go for a swim, ingest bacteria that are resistant to antibiotic intervention, and obviously become very sick. So that's a very significant human health risk, which there are papers published on as well. So my findings specifically, what did I find throughout my research in UCD? My research specifically was on risk assessment and comparative analysis. So specifically looking at different antibiotic groups and determining which of these was the most likely in the Irish scenario due to use, due to the amount released, due to the amount removed in wastewater treatment, which antibiotics in terms of healthcare versus agriculture were more likely to be of risk. So which ones should we curtail the use of, really? Macrolides were found to be the highest risk group within my research for resistance development and also for interruption of ecosystem services. And within the macrolide group, 2 antibiotics in particular, azithromycin and clarithromycin, were found, I suppose, through my literature research and statistical research to be the highest risk groups for ecological and resistance development impacts, respectively. One, I suppose, positive finding from my research was the potential for membrane bioreactors, which is a wastewater treatment method, different to the sludge method I mentioned earlier. So this is, I suppose, relatively new wastewater treatment method, but it shows very significant promise for reducing the amount of antibiotics that are being released. So with the 3 macrolide that I looked at, azithromycin, clarithromycin, and erythromycin, membrane bioreactor treatment suggested at least 50% reduction in terms of the antibiotic mass for each of those. The others were higher. I think 50% was the lowest, and I believe it was erythromycin. So bioreactor treatment has a significant potential to reduce the amount of pollution taking place, which is great. So in terms of risk reduction, so what can we do? One thing my research specifically calls for is monitoring of water bodies. So a regular, I'm sure you're all familiar with beaches are monitored regularly for their for different bacteria. It would be great in terms of being able to assess the state of risk to monitor water bodies on a constant basis for both antibiotic resistant bacteria, and as well as that antibiotic residues. With no idea of how much antibiotic, what levels of antibiotics are in nature, it's very hard for us to say what the risk level is. So constant monitoring would be hugely beneficial in that regard. As well as that, obviously, just for everybody here who isn't in charge of setting up monitoring programs for all of Ireland, finishing antibiotic courses fully. Obviously, we all know this. You're supposed to finish your courses even if you feel better. You should finish your antibiotic course, because if you take most of it and don't take the last bit, you can leave certain bacteria which are now selected for as the most resistant. And then when they repopulate, now suddenly you have an entire population that are resistant. So finish your antibiotic courses fully. More stringent prescribing practices. So obviously antibiotics don't work on viral infections, which is something that is an increasing awareness is being spread of. So more stringent prescribing, so not prescribing antibiotics for viral infections, and proper disposal of antibiotics. So as I mentioned earlier, landfill sites are hotspots for antibiotic pollution, because once they're discarded, rainwater washes down, the antibiotics enter the surface and groundwaters. So avoiding landfill disposal. So certain countries have drug take-back schemes where you can bring your unfinished antibiotics, or find them in the back of the press after a year, no problem, bring them in, rather than throwing them or flushing them, which some people do, which is obviously disastrous as well. So proper disposal of antibiotics is a big one. Manure storage. So as I mentioned earlier, adequately storing manure is a good way to reduce the release of agricultural antibiotics. So that's something we should something we should be aware of, and something we should all start to do. Those agricultural practitioners should try to do. And wastewater treatment technology, reducing untreated release. So not all wastewater in Ireland is actually treated prior to release. Some of it is just released without any treatment. So that's obviously disastrous in terms of what we're putting out there for a number of reasons. Treatment of hospital waste. So in certain cases, hospitals, which are obviously absolute hotbeds for antibiotic use, their wastewater is not specifically treated. It is just released to the generic municipal wastewater treatment facilities, which obviously aren't equipped to handle such a high volume of antibiotics. So on-site treatment of hospital waste would be huge. And as well as that, the sludge treatment versus newer methods, the membrane bioreactor treatment I mentioned earlier, would be huge in terms of reducing the amount of antibiotics being released, and therefore the selective pressure towards resistance development. So thank you all very much. Half an hour, perfect. So I'd like to invite any questions anybody has. I will stop recording just so that we can feel free to ask any silly questions that we might otherwise be nervous to do. So thank you all very much for listening, and any questions would be really appreciated.